Okay then, my lovely, make yourself comfortable. Just confirm your name for me. Thank you. Okay, so you're here for me to replace your filling, yeah? You've had a temporary filling done elsewhere, yeah, and it's come away. Okay. You're getting some pain now? I'm sure you are. Alright, yeah. So, do you know if you had a mercury filling in there originally? Okay, you think so? Alright. I will just need to check to make sure there's no mercury residue. If that's the case, then I'll just be able to refill the area. Okay, if we don't want any mercury in there. Okay, just making a note that you had the mercury filling before, or so you think. Right, okay. So I'll put a probe onto your teeth, particularly that area, just to make sure that there's no residual mercury. Okay? We can't use those fillings anymore, they're too dangerous, but I'll be putting a new composite material in. Okay? Alright, do you have any questions? Okay, wonderful. I'm just going to pop some gloves on, my lovely. I'll take a little look. You enjoyed the sunshine today? It's nice, isn't it? Makes a change. Okay, I'm just going to put a protective paper around you. Okay, let me just do that now. Okay, just pop that around there and clip that on there. That's good. Okay, all nice and covered up now. Okay, right then. So firstly, I'd just like to have a little look around in your mouth, if that's okay. Okay, let's get my tools. Just open nice and wide for me. Thank you. Okay. Okay. Just taking a look around to see the general health, but I know you've had a recent check, so that should be good. Right, so the area that we're going to be filling is this bottom right side, isn't it? That tooth there. Okay. Right. Yeah. Okay. So before I start doing any prep on that, I am going to check to see if we have any mercury residue. So I've got a special meter here. Just need to set up. Okay. This won't hurt at all. Okay. That's wonderful. Alright. So I'm just going to be placing this probe here onto that tooth and the teeth around it, just to make sure that there's no residual mercury. Okay? Right, here we go. Open nice and wide for me. Okay. Right. Okay. Doing really well. Just in there. Okay, just one more little check on here. Okay, just relax your jaw there. That's perfect. So there's nothing in there, so whoever removed your filling before did a really good job. But your temporary filling has come away a little bit earlier than expected. Okay, that's fine. Right. So let me just have a little feel around the area with my tool. Okay. You'll feel me tapping and scraping a little bit. All right. Okay. Nice and wide for me. Okay. That's perfect. Just relax there, my lovely. Okay. Right. So the process will be, I'll give you a little bit of local anaesthesia because the area is obviously a bit sore. The nerve may be still very aggravated, okay? So the tooth itself looks in fine order, okay? It's not crumbling away. The space where the filling has been looks absolutely fine. Very little residue is in there, so just taking that out, okay? But I am going to give you a little shot of lidocaine. Very, very small amount, okay? So you'll just feel a little bit of sharpness in a few areas around the tooth, but it will soon go very, very numb, okay? Perfect. Just make sure not enough in there. Yep, that's fine. Okay. Alright then, my lovely. Open nice and wide for me and keep nice and still. Okay? Here we go. Okay. There's one. Okay. Two. Alright. Perfect. Wasn't so bad. Okay. Just relax there while that goes numb. Perfect. Just have a little check there, my lovely. Can you feel that? Okay. Alright, that's good. Okay. So I'm just going to check a couple of fillings that you've got on this upper side while we're here, just to make sure that everything's good with them, because we could get them looked at as well. But I know from your dental records that have been sent to me that you've got those up there. Alright? Okay, nice and wide again. Perfect, thank you. You get no pain from those, they seem solid. Yeah, they seem sound. Yeah, that's fine. Okay. So, what I'm going to do next is put a little bit of a bonding mixture into that tooth. Okay. Just going to put some into the special syringe. Okay. And that just helps bond the filling to your teeth. Okay, just a little bit more in there. Okay. Perfect. Only need a small amount. Okay. Right, open nice and wide for me, my lovely. Okay. Here we go again. So just going to pop some of that in there. Okay, that's perfect. Okay, now I just need to use this special light that I've got here, okay, to cure it. Okay, so open nice and wide for me. I'm just going to be running this light all around that tooth. Okay. Doing really well. Doesn't take long. Okay. Wonderful. Just relax there. Okay. Okay. How's that feeling? Good. Can't feel anything? That's perfect. Alright, I'll just give you a little bit of suction. Okay. You've had your mouth open quite a bit, haven't you? Okay. Oh, lovely. All good. Right. So the next part of the process is I just have to mix up the composite. Okay. Just bear with me a little while I do this. So it's made up of a powder and a liquid. Okay. Okay. A bit more in there. I like doing this. Okay. So just need to get some of this. Couple of scoops of that. Okay. So just you relax there while I start to mix this up, okay? Takes a little while. The beauty of these fillings is that you can't really tell that they're there. They're not like the old Mercury fillings where you could see them. These blend in quite nicely with your natural colour of your teeth. Okay, so make a note of that. Right. That looks perfect. So I'm just going to get the tool here. And I'm just going to put some on there. Okay. That's better. That looks like a good consistency. I've got some of this. You open nice and wide and we'll get this in place, okay? Perfect, thank you. You're doing really well. There we go. Okay. Put that in there. I'll just grab my mirror. Okay. Okay. Just popping that into the cavity there. Okay, get rid of that excess and smooth that down. Okay, that's looking wonderful. Now what I need to do is cure this again with the special light, okay? Nothing's uncomfortable, is it? Okay, perfect. Okay. I just have to mark down everything that I'm doing and what product I've used. Right, so could you just bite down a little bit for me? Okay. And again. Alright, okay. Just need to get one of my bite papers here out of the packet. So there's some paper here, special paper. Just need you to bite down on it for me, okay? There we go. Okay, open wide. Yep, that looks fine. So your bite appears to be all good, which is wonderful. Okay, let me just give you a little bit more suction, okay? Make it more comfortable. Okay, lovely. Okay. So how does that feel? Yeah, pretty numb, I'm sure. So let's just have a little look around there now. Okay. Nice and wide again for me, my lovely. Just going to take a look all the way around that now. Okay. That's wonderful. I'm happy with that. I'm really happy with that. Okay, so I would encourage you not to try and eat on that side, okay, as much as possible for today. Yeah, leave it a little while until you have hot drinks, because you're not going to feel how hot they are with that numbness there. Okay, that should subside in a couple of hours or so. Alright, but just let that settle. It is set, but we do like to encourage you not to put too much pressure on that new filling for a little while. Okay? Yeah. Now, if you have any problems with it, if you start getting any pain, any swelling, or for some reason it doesn't stay in place, obviously just call us and we'll get you straight back in. Yeah? But as your dental health is absolutely fine, then I would say we'll just see you again in 6 months if you wish to come back to us for your dental check. Yeah? Okay, I'll just pop that through to reception to sort for you on the way out there. And you can also have a hygiene appointment as well. Although your gums and teeth do seem really clean, which is wonderful. I like it when people look after their dental health. Right, okay, so let me just remove this cover now, because you don't want to go home with that on, do you? There we go. All done. Don't need that anymore. Okay, so you're feeling fine, you're free to go. Yeah? Good. And we'll see you again in 6 months. But obviously, do come back if there are any problems. Okay, my lovely. Okay, enjoy the rest of your day. Reception will look after you on the way out. Okay? Take care.